Welcome to the Explainer. I am absolutely thrilled to have you here today because we are looking at something truly transformative. We're going to explore the GAHAR EGYCAP training program. Now, you should think of this program not just as a set of rules, but really it's an architectural blueprint. It is a comprehensive, step-by-step master plan designed to build a world-class, incredibly safe, and highly efficient healthcare system right from the ground up. So if you're passionate about healthcare excellence, you are definitely in the right place.
Okay, let's dive into this roadmap. We'll kick things off with the vision for better care, then move into leadership in the workforce, set up quality and patient-centered care, add in safety and infection control, and finally, embark on the path to accreditation.
First up, Section 1, the vision for better care, setting the national standard.
Before we can even start building, we really have to zoom out and look at the massive overarching goal for the entire Egyptian population. Safety is no longer a wish. I just love how incredibly direct that is. It perfectly establishes the incredibly high stakes of the healthcare industry today. It demands a full awareness of risks and hazards, and it sets a really urgent, proactive tone. We aren't just hoping for good outcomes anymore. We are meticulously engineering them.
So who exactly is tasked with building this incredibly safe environment? Well, the target audience for this training actually spans the entire healthcare spectrum. It calls on quality professionals who are out there driving continuous improvement, the frontline healthcare workers who need practical safety skills, and of course, the hospital leadership envisioning that final GAHAR accreditation. Transforming a whole system like this requires participation from absolutely everyone, from the executive boardroom straight to the clinic floor. Ultimately, the destination of this journey is to establish a much more equitable healthcare system for all, completely regardless of socioeconomic standard, race, or religion. The EGCAP program is striving hard to reduce the burden of illness and drastically cut down on medical errors. It's all about creating more value, less waste, and at the end of the day, improving the life quality of all Egyptians. Moving right along to Section 2, Leadership and the Workforce, laying the foundation. We all know no sturdy house can be built without a rock-solid foundation, which in healthcare essentially means your people. The EGCAP program pairs these first two modules brilliantly. Step 1 focuses on organizational leadership, recognizing that governing boards and managers are the ones who have to navigate these tough industry challenges. Then, Step 2 pairs this with workforce management because, let's face it, leadership needs a variety of skilled, highly qualified people with crystal clear job descriptions and strong training to fulfill the mission and actually meet the patient's needs. While exploring workforce management, you'll run into a vital concept known as clinical governance. Basically, this is a systematic approach to maintaining and improving the quality of patient care. It absolutely requires strong leadership and proper risk management. You can think of clinical governance as the essential bridge that connects high-level administrative leadership directly to the daily, on-the-ground clinical practice. And this brilliantly illustrates the balance we're talking about. We have the macro-level duties of organizational leadership, things like strategic planning, organizational ethics, and resource management, perfectly balanced against the micro-level execution of workforce management. That's the actual recruitment, the orientation design, and the performance appraisals. Both of these sides absolutely must be in perfect harmony if we're going to support continuous improvement. All right, Section 3, Quality and Patient-Centered Care, the core framework. Now that our foundation is poured, we move to the core framework of our facility. Every single daily operation has to be built around the patient experience. And Modules 3 and 4 work hand in hand to do exactly that. Module 3 focuses on the patient journey itself, guaranteeing safe access, perfectly smooth transitions of care, and really rigorous medication management. Module 4 then supports that journey through quality and information technology, ensuring that operational excellence is maintained entirely behind the scenes. That actually brings us to a fascinating question. How do we measure what we can't see? Providing safe, high-quality care is fantastic, but healthcare is a high-risk, incredibly high-volume industry. To truly sustain continuous improvement, we have to pivot to the critical and often totally invisible role of data and information management, covered in Module 4. To measure and improve all of this, EGCAP equips professionals with some serious analytical powerhouses. We're talking about methodologies like Focus PDCA for highly structured problem solving and Lean Six Sigma to violently cut down on process waste. It also introduces risk tools like failure mode and effect analysis, or FMEA. This helps predict where things might go wrong before they actually do, which, let's be honest, is way better than finding out the hard way.
The program heavily emphasizes that continuous improvement relies absolutely on valid data collection. Plus, with the massive rise of electronic systems, maintaining the security and confidentiality of that data is both an ethical and a legal imperative. You literally have to utilize data to make the right decisions at exactly the right time. Section 4. Safety and Infection Control. The Protective Shield. So the crucial point is, if quality is our framework, these 3 subsequent modules form the protective roof of our healthcare facility. Everything here is designed to achieve an organizational goal of zero harm. They form a comprehensive, impenetrable safety net. Module 5 tackles the overarching patient safety systems. Module 6 zeroes right in on infection prevention and control. And then Module 7 expands that protection out to environmental safety. Working together, they protect the patients, the staff, and the visitors. When we look at Module 6, we have to define the specific adversary we're fighting here: healthcare-associated infections, or HAIs. These are infections patients acquire while they are actually receiving treatment. The EGCAP program teaches that clean, safe care is a fundamental patient right. It combats HAIs through really strict standard precautions, hand hygiene, and targeted bundle approaches. Infection control isn't just a department, right? It's literally everybody's business. Beyond the microscopic threats, Module 7 outlines exactly how we defend the physical facility environment. Healthcare facilities have highly complicated systems, and those systems are prone to sudden failure. Defending the environment means we have to manage hazardous waste, implement airtight fire and disaster evacuation protocols, and conduct proactive inspections and maintenance of all that complex biomedical equipment. We simply cannot wait for a failure to react. Real safety requires constant, proactive vigilance. Finally, Section 5, the path to accreditation, the final inspection. Module 8 brings us to our ultimate inspection. Now, what's really interesting about this slide is the massive difference between basic licensure and true accreditation. Basic licensure simply means a facility meets the bare minimum regulatory requirements to open its doors legally. But GHR accreditation, that is something else entirely. It's a rigorous review process that proves an elite, ongoing dedication to a much higher level of performance, true continuous quality improvement, and truly optimal patient care. Earning that accreditation means embarking on the survey journey. An organization kicks things off with Phase 1, registration and intense preparation. Then comes Phase 2, the evaluation of standards using a very specific scoring system. Phase 3 is super fascinating. Surveyors use something called tracer methodology. They literally track a patient's actual path through the healthcare system to see how all the different departments interact in real time. Finally, Phase 4 culminates in the official GHIHR accreditation decision. And that brings us to the end of our blueprint, leaving us with one highly provocative question. Is your healthcare facility ready to commit to zero harm and prove it to the world? The EGYCAP program is a rigorous, demanding journey, for sure, but mastering these 8 modules empowers you to build a system of unprecedented quality. I really hope this explainer gave you a clear, structured understanding of exactly how this incredible training program works. Thank you so much for hanging out with me today, and keep striving for excellence.